In this video, we will start with a practical breathing test and then talk about the results, what you're actually measuring, how this affects your body, and how you can improve your bodily oxygenation. Let us start with the test. Breathe regularly and stop your breathing right after you breathe out normally. Start your stopwatch at this point. Then hold your breath as long as you can so that when you start breathing, your breathing pattern will not be altered. If you have to breathe heavily afterwards, you have held your breath too long. To get your accurate holding number may take a few practice sessions. Then, write down for how long you are able to hold the breath without altering the breathing pattern. A healthy result is 40 seconds or more. But if you had less, do not be discouraged. Today, most people are around 15 seconds. Interestingly enough, it is claimed that some 60 years ago, most people were around 35 seconds, while 100 years ago, the average was 40 to 60 seconds. Some yoga masters can hold their breath in this way for 3 to 5 minutes. Now, if you had around 20 seconds, then you probably have a natural pause between your in and out breath. So, what are we actually measuring here, and why is this interesting? We are indirectly measuring how much carbon dioxide, CO2, we have in the lungs and in the body. It may initially sound counterintuitive, but the more CO2 we have, the better we are able to oxygenize our body. This is due to Rigobord's law, which states that oxygen binds to hemoglobin much stronger in the absence of CO2 or at low CO2 levels. Normally, we have a high oxygen saturation, but only 25% of the oxygen in the blood is actually delivered to the cells in our body. When we exercise, the CO2 levels in our muscles rise, and this allows for more oxygen to be released to those muscles. When we hyperventilate, we remove CO2 from our system, and this can lead to tingling and cramping because although we are loaded with oxygen, we are unable to leave it with our cells. Also, higher levels of CO2 dilate our blood vessels, making it easier for the oxygenated blood to physically get to its destination. So having more CO2 in the body makes it easier for your cells to get oxygen. And why is this interesting? Did you know that most chronic illnesses like cancer, heart disease, candida, fibromyalgia, and so on are highly correlated to a lack of oxygen and a lower tissue pH value? Increasing your ability to oxygenate your body will help you to relax more, feel more energized, improve brain function and the ability to concentrate, reduce or eliminate breathing difficulties, improve your protection against degenerative diseases, reduce chronic illness, and more. Here are some tips to improve your breathing. Breathe through the nose. Sleep with your mouth taped shut, but check with your physician first. Breathe lower in your belly and not in your chest. Rest between the out-breath and the in-breath. Do alternate nostril pranayama breathing, where you breathe out and then in through one nostril, then you close it and you breathe out and in through the other, alternating. If you have around 20 seconds of breath holding time, you can start exercising while only breathing through your nose. Then try only breathing through one nostril. You should be on the verge of feeling uncomfortable. But do not do this if you have strong asthma or less than 10 seconds holding time. Use breathing equipment developed by Vladimir Frolov. There are also supplements and dietary alterations that can affect your ability to oxygenize your cells. And how does this compare to the Wim Hof breathing exercises? The Wim Hof method leads to very low CO2 levels due to the hyperventilation and low O2 levels as you stop breathing. This is because hemoglobin usually already is saturated with oxygen, and only very little is dissolved in the blood. These exercises are a good stressor for the body and can lead to changes, especially in the immune function, which can be great for autoimmune diseases. But the method we describe here is based on Konstantin Buteyko's work, and it is a high CO2 and low O2 method. This too leads to adaptations in the body, especially through exercises, while only breathing through one's nose or one nostril. The set point of CO2 will eventually move, and we will eventually be oxygenizing all of our cells better. Let me know your thoughts and experiences. I'm curious, what was your holding time? Thanks for watching.